Much. Perfect.
And there we go. Okay, welcome everybody. Good day. I'm Michael Ann Miller, and I'm the current president for the Canadian Association for Rural and Remote Nursing. And it is a pleasure to be here today presenting with you. And I'll introduce my partner, Ricky. You can share a little bit about what you do, Ricky, but before I forget, I was a rural and remote emergency nurse for over a decade in beautiful British Columbia, where I still live. I worked and lived in that community and absolutely fell in love with rural and remote nursing, and it became a great passion of mine. I had started a blog, and it was actually the past executive of CARRN that found me, and I ended up in this role. So currently, I manage two teams in the Similkameen Valley of the Okanagan, and again, what a pleasure to be here. So, Ricky, I'll pass it to you.
Sure. Hi, everybody. My name is Ricky Nunweiler. I I was a rural and remote nurse like right out of school. So I graduated in 2019 with my undergraduate and I went straight to rural nursing. I did rural acute care, emerge, long-term care, and home care. And currently I work in Saskatoon right now. I still do a bit of rural home care and a bit of urban home care. And I'm also working to get my master's in professional practice and leadership. And my focus has been primarily on rural nursing. And that's definitely where my passion and where my heart kind of lies. And so I hope to get back to rural nursing one of these days. And for now, I'm working with CARRN here just to kind of keep my passions going and yeah, work to kind of improve and advance rural nursing.
Thank you, Ricky. So, um, this is a topic that's near and dear to our heart. So we're going to talk a little bit about, what rural remote nursing is, what makes us different. Everything we're going to share today is based on a theoretical framework that was produced by past members of the CARRN executive. So although this is our lived experience, this is also based in research and theory, which is one of our main accomplishments as an association and something we're extremely proud of. So with that, we will get started. I'm just going to lose all my buttons here. So a brief introduction into what rural and remote nursing is. So really, we are a specialty that's characterized by our unique environment of which we practice. So many nurses work in environments that can be isolated and have some limited resources. The CARRN framework was developed in 2020, and it provides us with a structured approach to understanding and navigating some of the challenges we see. And it highlights that we really truly need to know our communities in order to provide effective care. By the end of our session, I'm hoping that you have a better understanding of what rural and remote nursing is and how it differs from other specialties. So a big part of knowing what a rural nurse does is understanding the rural context. And one of our core elements is really understanding the communities of which we serve. So unlike urban settings, rural communities often lack the same access to resources, including healthcare infrastructure, technology, and other specialized supports. According to Statistics Canada, 16.8 of the Canadian population lives in rural and remote areas, and that's over 5.9 million people. So these communities are diverse. Everyone has their own distinct needs. And as rural nurses, we are deeply embedded in these communities. And we don't really just care for patients. We know them, we know their families, and we often know their struggles. So our understanding of the community context is very crucial to us being able to provide holistic care. In the framework, we've identified some guiding principles of rural nursing practice. And really, these are the pillars that shape what we do. And first and foremost is our the way we provide holistic patient-centered care. So this means not just seeing our patients as individuals, but members of a community, as well as the context of whatever's going on in that community in terms of the social, political, and health environments. We really empower communities to be a part of the services and some of the healthcare decisions that we make. And there is a huge level of engagement that happens through our practice that promotes that. We really function best in collaborative environments and working collaboratively and in cooperation with many interprofessionals and multidisciplinary teams. Often you may be the only nurse working, but you would work with physicians who may or may not be known to that community, and you may be working with other outside healthcare providers in order to meet the needs of patients. And importantly, we really are guided by the social determinants of health. And that's something you may be learning in school. And if you go into other areas of nursing, it becomes kind of, one of those foundations of your practice, but not something that you may necessarily see in critical care and things like that as overtly as you do in rural nursing. Whereas really, even in a rural emergency department, you are seeing the effects of social determinants of health. And we know in rural areas, there's challenges with income, housing, education, and these can all impact our patient health outcomes. This is a beautiful quote that I think really sums up a rural nurse's practice. And that's, rural nurses are the masters of ambiguity. We navigate complex external forces like distance, isolation, and limited resources to deliver care where it's needed most. With that, we do see some unique challenges. And one of the biggest challenges, and really what can set us apart from other areas of nursing, is the challenge of geography. So we live in beautiful spaces that are geographically quite isolated from other big centers and areas. We can have challenges with our road infrastructure. Climate change has been a huge impact on the health and wellness of our rural and remote communities. And we really often are practicing in areas that are isolated from urban supports and larger tertiary centers. And this makes it a little bit more challenging to access specialized healthcare and advanced technology for our communities. When you have geography, you also have the weather. And weather is something that becomes part of your day-to-day practice. And it seems somewhat odd, but it makes a huge impact. So you may be working in a small emergency department and have a critical patient that needs to get to a higher level of care somewhere else in your province or territory. But the road might be closed. There might be a blizzard. The helicopters can't land. These are all factors that we navigate daily in taking care of our patients. And it becomes almost second nature, and something when I went into nursing, I really loved that part of rural because it made me have this really strong connection to the land and the environment. And I found that really grounding. The other unique feature is our expanded scope of practice. So in rural, we really often take on roles that would be much more specialized in urban settings. So for example, you might be providing emergency care, primary care, and even palliative care all in one shift. And that takes a unique skill set to be able to navigate all those different areas. And you think about the different assessments. And that's one of the features of being diverse and flexible in your way of being as a rural and remote nurse. I'll dive into a bit deeper into the expanded scope of practice. So we like to call ourselves the expert generalist. And really, what does that mean? So we need to be prepared for anything. And I've worked a decade in rural, and I'll tell you, you have to be prepared for anything. Rural and remote sometimes has a bit of a connotation that not much happens, but actually 47% of all traumas happen in rural and remote areas. And that is a fairly significant statistic when you think about the level of expertise that trauma patients require. And you're often working in isolation. You may be the only RN and a charge nurse. You have a lot of autonomy in how you practice and the decision making. And that again was a feature I really gravitated to. I worked urban in a big center, and although I learned a lot and it was a great experience, I really desired that autonomy and to be able to somewhat stand alone in my practice. And of course, always working collaboratively, but really getting to own what you do and how you do it. We often work full scope. So again, areas that might be more specialized in urban or, even larger communities. For rural, it becomes everything that you do. And we often say that we are the jack of all trades and masters of none. However, I think CARRN likes to challenge this in that we like to say we are the jack of all trades and masters of it all, because we need to be to ensure our patients get the best care. So when you have an expanded scope of practice, you really need a lot of versatility. And this also means continuously updating your skill set. So we frequently encounter situations where you have to make critical decisions with limited resources. For example, a rural nurse might stabilize a trauma patient 1 minute, and the next you may be engaging in a discussion on chronic disease for an elder. And this is the complexity that makes rural nursing both beautiful, but at times very challenging. And this is another quote just to kind of summarize that flexibility. So rural and remote nurses often practice beyond their defined scope, becoming the expert generalist, providing care across the lifespan from acute emergencies to chronic disease management. And with that, I will pass it over to Ricky.
Thank you, Michael Ann. I think just to go back to the expert generalists and the expanded scope of practice, you really see that in rural, and just in my practice, I've seen a lot through Emerge. And it's interesting because urban Emerge, you also will see a lot of different things and have to recall lots of different things, but you see them probably more on a regular basis. Whereas in rural Emerge, you see you see maybe a lot of cardiology. That's in my practice what I saw a lot of. But for instance, we would all of a sudden have a neuro patient come in having seizures, and I didn't see that for a year or even in nursing school. So now you're having to recall that information. And the difference there is also that in my facility where I worked, we were acute care and Emerge together. So, you see them all the way through, especially if you're not transferring them out. You'll see them in the Emerge, and then you'll just pop them in a room that you're also managing. So it's interesting because you can see care from start to finish sometimes, which is very interesting. Anyway, I'll keep on going. So yeah, community visibility is a huge thing in rural. Anonymity is almost not always possible. So it is a unique aspect of rural nursing to be highly visible in our communities, but it can kind of blur the lines between professional and personal roles. So especially in smaller communities, you might be taking care of neighbors, friends, or family. So this presents a lot of challenges in maintaining confidentiality and professional boundaries. But it also can foster a very deep trust between nurses and the community, which can sometimes enhance care, especially for people who find that to be very important. So our role extends beyond the clinic and the hospital sometimes. You're going to the grocery store and somebody's asking you, hey, I have a question about this, or, my mom's in the hospital right now. It just can be very iffy. So you have to be very I guess, strict with boundaries and whatnot. But we're also seen like as very trusted healthcare advisors in the community. And this trust is definitely a critical component of our practice. Okay, so yeah, persistent challenges in recruitment and retention are a huge issue in rural nursing, and there's lots of factors that go into that. Recruitment and retention, in rural communities, they like often struggle to attract and keep healthcare professionals, which often I'm sure a lot of you have heard or seen, talk about service disruptions or like emergency department closures, especially in the last couple of years. It's really kind of ramped up. And when COVID hit, it was very big. So some of the reasons include like limited housing opportunities, isolation, both geographical and professionally. So there's also less like professional development opportunities. And so our framework emphasizes the need for pathways to support nurses from their education into rural practice, including mentoring programs, continued professional development opportunities, and often students in nursing programs are not exposed to rural and remote practice settings. If you are, that's amazing. But I know in my schooling, I think we had like a very small portion of one of our, like, I think in fourth year, it was our last class that we had before preceptorships. And there was just a small little tidbit on rural and remote nursing. And I don't think that was even a main focus of the class. So yeah, often there's limited knowledge and awareness about kind of how amazing rural and remote nursing is, but also how challenging it can be. So that's kind of one thing that really we're hoping will improve going forward. I know like it seems like it probably should be easy and that a lot of the things you learn urban transfer to rural, but I know there were some things like when I finished school and went into rural nursing that I was quite caught off guard by, and some of the things we've kind of already talked about with how closely you work with the community and how collaborative it is, but also how many things you lack in rural that you have in urban that you rely on. So yeah, community engagement is crucial to ensure like housing and other social determinants are considered. So yeah, for nurses, especially people who are hoping to rent, that's really difficult in a town of only 800. It needs to be a very collaborative approach, and I think some communities do have committees actually that will help nurses or doctors find housing and connect them with other people in the community. And yeah, so with the social determinants of health, it's also like Glenn was saying earlier, it's something you do see quite overtly in rural. As rural nurses, we need to be acutely aware of how social determinants of health affect our clients and patients. So in rural areas, issues like lower income, reduced access to healthcare, and lower educational attainment are more common and can significantly impact health outcomes. So our role is not just about treating the illness necessarily, it's also about addressing these broader systemic issues and advocating for our patients and communities. So rural and remote nurses are often in a position to highlight inequities and push for policy changes that improve access to care and overall health in the community. So issues like climate change, like Michael mentioned, and other social determinants of health and rural and remote nurses have been key to ensuring safety of whole communities through emergency response and advocacy for better environmental policies. Just even talking about kind of the weather again and climate change and whatnot, we're seeing a lot more, I would say, like grass fires, especially the past 2 years where it was very dry. So we were seeing lots of field fires. And I can think of one close to my community that happened quite a while ago, but I think 2017, it was massive. I think it extended like all the way. I'm in Saskatchewan, so extended from the Alberta border in like well into Saskatchewan. And we were at the center. They were having to get all of the patients out, get all of the clients out. Meanwhile, you still have people showing up to emerge, and you're kind of balancing, okay, caring for people, but also planning for this incoming need for evacuation, I guess. Okay, so culturally safe care is also a very important part of our practice, especially and particularly when working with Indigenous communities. We must engage with the cultural context of the populations we serve to provide care that respect their traditions, values, and needs. So this means building relationships based on trust, truth, understanding, and respect, while also addressing historical and ongoing inequities in healthcare access for Indigenous populations. And rural nurses are again in this unique position to advocate for culturally appropriate care. And this is an area where we can have a profound impact. So, I mean, another kind of where I worked in the southwest part of Saskatchewan, another group that was very common, we had a lot of Hutterite colonies that were around my area. So very different cultural, very different I guess like cultural practices and things that were important to them. So, when you're caring for them, you kind of keep those things in consideration. I would say like privacy and confidentiality, of course, are huge. And just modesty, respecting dignity and whatnot, especially if you're caring for like some of the women at the Hutterite colonies. Modesty is huge. So just making sure that, if you have a male doctor, just kind of trying to balance all that. And that's things that are important to them. And yeah, now going with advocacy and leadership, like my Glenn said, sometimes you're the only registered nurse maybe in the building at the time, or maybe, your whole facility only has a group of like 5 registered nurses and maybe another 5 LPNs or so. And then, Carrie's working in the long-term care side. So you're a very, very small group. So sometimes that can be overwhelming, but because your facility is also small, you have, 5 or 10 nurses or so to advocate for the whole entire facility. And often you work very closely with other professions. So that kind of gives us a great opportunity to advocate while seeing the whole picture, I guess. In many cases, we are the ones bringing attention to broader health issues that affect our communities, such as mental health crisis, substance abuse, and environmental health concerns. So while many rural remote nurses are also not just responsible for the health and well-being of their patients and communities, but also the facilities and health systems infrastructure that is associated with what we do. So this is a huge responsibility that is often not taken into account when looking at the innate leadership aspects for rural remote nursing practice. So yeah, that's true. Everything, you're kind of looking at everything in the building. You're kind of the eyes and ears for everything, right? So you're the one sometimes putting like stop orders on equipment if it's not working, and flagging that, and not just equipment maybe that we use, but building equipment and whatnot. So lots to take into consideration. Advocacy and leadership are essential to making sure communities' voices are heard and their needs are met. So by engaging in local and national health policy discussions, we can help shape the future of rural healthcare. So why consider rural and remote nursing? Well, rural and remote nursing offers opportunities to practice as an expert generalist, developing a wide range of clinical skills and the ability to work across multiple specialties, from emergency care to chronic disease management. Nurses in rural settings become integral to the health and well-being of the communities, fostering strong relationships and providing care deeply rooted in the social, cultural, and environmental context. We also often lead initiatives that address social determinants of health, advocate for equitable healthcare, and influence local policy, and which are skills that are essential for creating meaningful change. Working in rural environments nurtures adaptability and problem-solving skills as nurses navigate geographic isolation, limited resources, and the unique challenges of each community. I know like when I was working in the rural emergency department, we had one client who was in DKA and actually should have been transferred out to ICU. They were not doing well, but for one reason or another, the urban center had denied them being transferred. And so they needed to be on our heart monitor consistently, which we only have one, which is in the emergency department, but they were now an inpatient. So, you know, taking that from there, and we had to kind of collaborate and talk with our paramedics to get theirs and have it on standby just in case someone came in through emerge. So we also didn't have a lot of the equipment needed to monitor them. You know, with DKA patients, you often have like lines, multiple lines running at once. Some of the tubing we didn't have that was necessarily appropriate. So now you're problem solving that. And that's just kind of an example of how complicated it can get, which can be very nerve wracking. But it's, you know, sometimes what you learn in undergraduate school with how to treat a certain illness, that's not how you're going to be treating it in rural. And that simply just sometimes comes down to what we have and what we don't have. So, yeah. Anyway, it's very rewarding and very challenging, and you kind of see a bit of everything. Okay, I think that's pretty much the end. We love if you'd connect with us further. We have a website. I think if you just Google CARRN or the Canadian Association for Rural and Remote Nursing, you can find it there. Student memberships, we have student memberships, so consider that. It's $20 for the year. You get access to rural and remote research. So we kind of send out monthly newsletters in an email, or monthly emails, sorry, with rural and remote research, different things that are going on, kind of what the executive is doing. And we do 2 newsletters in a year usually. But also we do like to highlight like any rural and remote research. So whether you're a student and you're looking at rural and remote research, we can put that up on our website, maybe put it on socials, those kinds of things. We also do free educational events. So we just had our AGM. And yeah, we do, usually with our AGM, we do some sort of an educational opportunity. And yeah, it's a good opportunity to connect with others who are passionate about rural and remote nursing as well. Okay, and I think we can maybe open up to questions.